Hello all, hope you all doing fine. Let's discuss some of the Prometric exam questions for nurses. A multiparous mother is attending at the outpatient clinic 2 weeks after the delivery for a follow-up. While the nurse is assessing the mother, she should not palpate the fundus. Which of the following is the most appropriate nursing action? So she is palpating the abdomen and then she cannot palpate the fundus. Yeah. So the options are document the normal finding, massage the fundus to be firm, assess lochia amount and color, admit the mother to the hospital. So the correct option is document the normal findings because after the 2 weeks postpartum, the fundus shouldn't be palpating. A woman breastfeeds her infant 1 or 2 hours and her infant cries most of the time and she feels pain in her breast. Which of the following instructions are appropriate for the nurse to give the mother? Regulate breastfeeding every 3 hours. That's normal feeding problem. Shift to bottle feeding and start weaning your baby. So the correct answer is regulate breastfeeding every 3 hours. Which of the following is considered as the main complication of maternal postpartum hemorrhage? So if there is postpartum hemorrhage, what is the main complication? Death, candidiasis, cervical cancer, uterine prolapse. So what is the correct answer? Death. A 5-year-old child was brought to the emergency room with a fractured forearm. He had several bruises on his body. He seemed scared and did not answer any questions. Why should the nurse discuss this case with the nurse manager? The option continuity of care, rule out child abuse, psychological support and fracture management. So what is the correct answer? Rule out child abuse. Why? Because he has a fractured forearm and several bruises on his body. While caring for a neonate with meningococcal infection, the nurse should avoid positioning the child on the abdomen, left side, right side and back. So it should be the correct answer is back. There is possibility of high ICP and all those. So better to keep him on the back. Infant is born with spina bifida. Which of the following complication is always found in these infants? So the infants with spina bifida, what is the complication? Hydrocephalus, craniosynostosis, meningitis, cerebral palsy. So the correct answer is hydrocephalus. Which action nurse need to include when caring for a newborn receiving phototherapy? Expose owl surface, prevent stimulation, cover the eyes with shield and change position every 4 hours. So what is the correct answer? Cover the eyes with shield. A nurse performing nursing care plan for a neonate after birth. Which intervention has the highest nursing priority for neonates? So it's just after the birth. Obtain a dextrosticks, give the initial bath, give the vitamin K injection and cover the neonate's head with a cap. So the correct answer is cover the neonate's head with a cap. For what? For thermoregulation. Yeah. Thank you and we'll see you in the next session.